so that we could sort of walk through the basics and in the first couple of webinars. So the first one, this one being the basics on becoming a certified application counselor, and Aurora will explain what that means in a minute. And then the second one is about the basics of providing assistance for Medicaid and CHIP enrollment. And then we do the same thing again, where we go over the similar information, but this time more in depth on what it means to do that enrollment virtually during the time of social distancing. So we're excited to have everyone here. There are I'm just gonna go over a couple of housekeeping things. First and foremost, this is being recorded. You will get a link. You're welcome to share it with your staff or any other community-based partners who might be interested in this information. And that you will get a link to that in a follow-up email 24 hours from now. So tomorrow morning, you'll get a link to the recording in your email. Also, if you notice at the bottom of your screen, you'll have a couple of different buttons that you can use. One is for chat feature. I know we've all done a lot of Zoom, but this is a webinar setup, so it's a little bit different than if you've been using Zoom primarily for meetings. So there's both a chat feature, which you're welcome to use, and please do say hi to us. We would love to know that you can hear us. And but then in addition to the chat feature, there's a Q&A function. This is a great place if something comes to mind and you'd like to ask a question, then you can use this to put that question in, and it gives us a chance to sort of track those questions. It's a little easier to track questions in the Q&A function than in the chat. So please take advantage of that. We'll be monitoring both chat and Q&A. If you have a technical issue, if you're not hearing our audio or something goes wrong, you may hear our audio now, but maybe 30 minutes from now, our audio is not working. Please flag that for us in the chat. I will just be running this from a technical perspective so that Aurora can focus on the content and I can focus on making sure that everybody's hearing okay and able to communicate okay. So so please use those Q&A functions and those chat functions. And we will be sharing, we already mentioned we'll share the recording, but you will also get a copy of the presentations. I know that's always a top question in the beginning. If you can hear us, can you put something in the chat just so that we know everyone can hear our audio just fine? We just want to make sure. Yay, great. Thank you for that. And please do feel, it's a small group today. It's probably going to get a little bit bigger as as people get a chance to sign in, but it is still a fairly small group. And so we're very happy to engage, and possibly even at the end, I have the ability to unmute people. You won't be on video, don't worry. There's no way to do video in a webinar, but I could unmute you and we could do some questions out loud since it's such a small group. So with having said all of that, I will turn it over to our presenter for the day. Aurora, take it away.
Thank you so much. So good morning, everyone. I'm just so blessed and feel honored to have you with us. Like Melissa said, it is a small group, so hopefully this will be a bit more interactive than the webinars you're used to. Today, I'm going to talk about becoming a certified application counselor. It's not scary. It's pretty simple, and we're just going to talk through the basics of it. We're going to talk through what it means to help people register for a health insurance program on healthcare.gov, or as you might hear it in the community, probably called Obamacare. We know that our community is experiencing lots of job loss right now, lots of uncertainty. And one thing that is certain and has always been certain is that healthcare.gov remains the law of the land. It remains an affordable way for lots of people to be able to access a health insurance plan. So we're going to talk about how you can have a tool to be able to help people navigate that process, let them know what they qualify for, and really help our community get access to health insurance when healthcare is critical. So a little bit about me. I am a millennial, and so My first time being able to like register to vote and vote in a presidential election was the Obama McCain election, and it was really exciting for me because it was, you know, the first Black president. I'm a Black woman, and so it was the first time I'd seen a president who looked like me and really talked about issues that I cared about. You know, at the time, I was an uninsured young person, and I saw my mother struggle without access to healthcare for, you know, most of her life. And I was just really, really excited about a change in our country around our healthcare system. And so shortly after Obama's second term, I became a certified application counselor. So these are some old photos that you see of me here. This was, oh my gosh, probably like 5 or 6 years ago. It was really, really exciting time. I was really excited to let my community know about the Affordable Care Act, about what it was. There were so many different things going on in the media. Sound familiar, right? Still so many things going on in the media. Lots of information, lots of misinformation. And so I was really excited to be able to help my community understand what they were eligible for, understand what the ACA was, understand healthcare.gov, and register and enroll folks. And it was one of the most rewarding things I've ever done in my entire life. I remember signing people up who had never had healthcare before, signing up people with pre-existing conditions, and I mean, people would literally be in tears because they had access to something that was affordable that they had never had access to. And it was really exciting for me. So at the time, I myself was uninsured, and I ended up enrolling myself in an Obamacare plan. And it was one of the first times I, as a young adult, actually was able to access healthcare for myself. I had gotten a well woman exam. I hadn't had one in over 5 years at the time. You know, I had just gotten general screenings that I hadn't been able to keep up with, and things that really weren't on my radar, and it wasn't a part of my life. Seeing a healthcare provider just was not a part of my life because it wasn't something I had access to. So again, it was just really, really rewarding for me. And these are photos from people when I first was a certified application counselor. And after folks would enroll in plans, they would take little pictures about why they love the ACA. And these are just some of the like smiling faces of the clients that I worked with. And it was just a really powerful experience for me. So I wanted to share that with you all. After I was in the CAC, I got even more passionate about healthcare access and started working as a community organizer in the LGBTQ health space. And now today I'm the regional director at Young Invincibles, and we are a national nonprofit organization committed to elevating the voices of young people in the political process and expanding economic opportunity for 18 to 34-year-olds. And a huge part of economic opportunities is healthcare access, and making sure young people aren't swamped in medical bills and have access to the healthcare that they need so that they can live and thrive and be economically stable. So I'm really excited to continue the legacy of being a CAC in one aspect and now doing things on the policy and organizing side around healthcare, particularly here in Houston and in Texas. So again, like I said, our core policy areas are healthcare. We also work on civic engagement, higher education, and workforce development for young people. So I'm not going to go over this. Melissa so kindly went over Zoom norms before this, but just making sure that we remove distractions is one big one. I know for me, I'm always on Zoom calls, and I'm sure you all are too, and it's easy to check email, check text messages, you know, do all these other things. And I find it really helpful to just kind of center myself, especially if someone's presenting information, and just try my best to stay as engaged as possible. Grab a beverage, some note-taking materials. Tech happens. We're in this together. If you're having any tech issues, like Melissa said, let us know in the chat box. And since it's a small group, please feel free to use the chat box and Q&A throughout the session, and I'll be checking that so we can be more engaging. All right, so welcome. We're going to talk about becoming a CAC. It's as easy as 1, 2, 3. If you like Jackson 5, think about it that way. So our agenda for today, we're going to talk about what is a certified application counselor, what's the background of it, what are the responsibilities, how do you become a certified application counselor? So what is the training like? What's the registration and enrollment like? How do you get certified? And then we're going to dig into the work of a CAC. So once you get that certification, what is it like to assist consumers? What are the common challenges? Why is it important? Right now, what can we be doing in the time of COVID and social distancing? And what are the resources available to you to help you do your job better? All right, so in one word, name something that you want to take away from this workshop. So I want to make sure that my agenda is good and that if there's anything else I missed, we can make sure that I cover it. So there's something else or something I've already might have said in the agenda, but what's, in one word, what's something that you really want to take away from this workshop? And I'll give folks a minute or two to the process. Okay, we'll definitely cover that. Ooh, a fresh perspective. I will try my best. Definitely try to cover that. Anything else? Okay, well, we'll definitely cover the process, definitely give you all a fresh perspective on what it's like. What else we got? Updated information. Yep. I'll definitely do that too. Perfect. So I'm on the right track. That's good. That is not what I meant to do. All right. So what is a certified application counselor? What is it? So bit of a background. So the Affordable Care Act, or Obamacare, rolls out 2013, right? So at the time, if we all remember, there's a new mandate that everyone has to have health insurance coverage. Now we know that this is no longer the case, but at the time, there's this federal, everyone has to have health insurance coverage. I don't know if we all remember that. If you didn't have health insurance coverage, right, at the end of the year when you filed your taxes, you would have a penalty. So there's this new mandate that everyone has to have health insurance coverage. Plus, you have this new way to buy insurance. So the Affordable Care Act put together these marketplaces. This was, on healthcare.gov, this is really the first time that everyday average folks could go on and look at health plans all together the same way you would shop for, a sweater online at Target. You can see all the different sweaters, the colors, the prices. You could do the same thing with health plans. This is really the first time folks were really able to do that. And so you had the federal mandate that said you had to have health insurance, and then you had this brand new way of buying health insurance. You had new regulations and consumer protections that were within the Affordable Care Act. So you had things like you have to cover pre-existing conditions, mental health parity, children on a parent's plan until they're 26, all of these different consumer protections. You put all that together, and there was this huge need for consumer outreach and enrollment assistance, because what was happening was that you had generations of people like myself who never had access to health insurance before, never shopped for it before, couldn't tell you what a deductible was if you slapped me in the face with it, right? You had all of these different things. You had people who had never, who hadn't shopped for a plan in a really long time because they had a pre-existing condition. You had all these new rules and experiences that people were coming with. So there was this need for more consumer outreach and enrollment assistance. Therefore, the Navigator and CAC programs began. Now we have, a bit of a changing landscape, right? So this was back in 2013. Those sort of same rules, administrations are no longer there. So now we have a lot of a changing landscape. So at the time, in 2013, and a couple of years after that, there was robust funding to support navigators, to support people, to help people understand the Affordable Care Act, to help people understand the healthcare.gov website, to help people understand health insurance literacy. There was huge ads. I don't know if you all remember television ads, billboards, all of these things for healthcare.gov, because it was this brand new policy, right? This brand new website, this brand new bill. So we had all those things. Once we got the Trump administration, and once the ACA kind of Obamacare kind of became a household name, right? Like the administration reduced funding for outreach and advertising by 90%. So it went from $100 million to just $10 million in the last open enrollment periods. And you could say that the ACA became a household name, or you can say it's because we had very unfriendly administration to healthcare.gov. Was probably a bit of both. That funding was cut. Navigator funding, so those are the grantees for the federal government to help people navigate healthcare.gov. That was reduced by 84%. Also, Navigator programs are no longer required to be physically present in the state. And there's no longer a requirement to have 2 Navigator programs per state. So what we're looking at right now is that we have 2 navigators in the state of Texas currently. One is here in Houston called Change Happens, right there in 3rd Ward. But basically, we have completely seen a changing landscape where the ability for folks to get help and service for healthcare.gov has completely been cut. We've just got one group, Change Happens, that's a navigator here in Houston. And so the Certified Application Counselor program is a really incredible way to sort of make up for all of these cuts that have been done over the past couple of years. So there's 3 types of consumer assistance that I've been kind of talking about. The first one is a navigator. They are grant funded by the federal government through the Center for Medicare and Medicaid Services. They focus on outreach, enrollments, and post-enrollment issues, and they have a lot more rigorous training when it comes to enrolling people in healthcare.gov and in the Obamacare plans. Then you have your certified application counselors, and those come from a variety of funding sources. The focus is on enrollment and less on the outreach piece, but as a CAC, you can do outreach. And the training is less extensive. If you sit down and do it in one sitting, it takes about 8 to 10 hours. And then you have, those are folks who work for Blue Cross Blue Shield, work for Molina, they work for a private health insurance business, and they're paid on commission, but they are able to help people navigate the healthcare.gov as well. So in order to become a CAC, you have to attach yourself to a CAC designated organization. These organizations apply to CMS for designation, so they apply to the federal government to be able to do that. And a common CDO might be a community health center, it might be a hospital, a social service agency, or a community-based organization. And we at Young Invincibles, we are a CDO, so we can designate CAC. So if anyone on this call is, after this presentation, really interested in becoming a CAC, I'm happy to help designate you and walk you through that process. So what are your duties as a CAC? So you have to educate consumers about the health insurance marketplace. So you're going to educate them on healthcare.gov, what they qualify for, the health insurance plans, all that kind of fun stuff. You are expected to explain the full range of marketplace plans available to the consumer, so to your clients. You are expected to assist the consumer with completing the marketplace application. And you help facilitate consumer enrollment. So you explain to them their eligibility, you explain to them the financial assistance if they receive it, and you help them with their plan selection. So as you're doing all of this, you have to remain impartial at all times. If you have a really great plan with Blue Cross Blue Shield, it's not your job to help funnel people into that plan for them, for themselves. You have to remain impartial and just really be there to provide information, help them through the process. But at the end of the day, they ultimately make the decision about what healthcare plan they pick, if they take the tax credit or not, if they enroll their children in Medicaid, CHIP. That's all kind of up to them. You're there to just provide information. Your information that you provide needs to be accurate, right? Obviously. And you cannot accept payment or gifts. This is really, sort of a volunteer role, unless maybe CSC is as a part of your work at a health center or something like that, but you're not to accept payment or gifts or anything like that for this. You may also conduct community outreach. So as you saw in the beginning photos, I did a lot of community outreach, particularly in the Greens Point community. I was at churches, I was at health care clinics. I was at sorority and fraternity events. I was out there with the table with the laptop. This is before COVID, obviously, doing lots of outreach. And I would actually sit down and enroll them in healthcare plans right there on the spot if they were really interested. You can also provide health insurance literacy education, and this is something that I do a lot. So you can do a workshop on health insurance literacy where you explain deductibles, co-insurance, networks, formularies, accessing healthcare, you know, how to find a doctor, when do you go to the ER, when do you go to a primary care provider, what is a primary care provider? You know, so many folks in our community do not know these concepts, and it's just really, really important, and it makes your job a lot easier when it's time for them to pick a plan if they actually know what these concepts are. And then you can also provide some post-enrollment assistance. So say you enroll someone in a healthcare plan and they're having any kind of issues, or they don't understand their tax reconciliation, or they don't understand their appeals process, you can kind of help them with that piece. But you cannot provide legal or tax advice. So that's kind of where assistance kind of stops. You can't provide any legal or tax advice, but in post-enrollment assistance, you can help with some of these other issues. So before I move on, are there any questions about what a CAC is, what their duties are, anything like that before I keep going? Okay, cool beans. All right, so let's talk about becoming a CAC. I know that in the chat that folks are really interested in this. We're gonna talk about how do you become one? So the first thing you need to do is you need to connect with your CDO. So that could be Young Invincibles, that could be a community health center, another organization, but you need to connect with the CDO and figure out what their expectations are. You know, are CACs expected to focus mostly on enrollments, or are there other duties that I have to do? Do I have to do a certain amount of outreach events? Do I have to do the same workshop with everyone and come to your volunteer program? You know, there are lots of different responsibilities. And so you need to connect with the CDO and find out what those things are. You need to find out the CDO's certification process. So have additional requirements outside of just taking the test. So you might want to think that through and connect with them and figure that out. And then you need to figure out the CDO's reporting requirements, right? Because when you become a CAC, your CDO is going to want to know, how many people did you talk to? How many people did you enroll in a health plan? You know, how many email addresses did you collect, et cetera, et cetera. If they want to collect all that information, you know, you need to figure out what that reporting requirement looks like so you can make sure you're kind of fulfilling your duties to that organization as well. So that's the first step. The next step is preparing to get certified. So you're going to get your unique CAC ID from your CDO. And the CAC ID is something that you will use. I believe you can enter it into the healthcare.gov application. And it's also something that you can have on display, or something you can show to a client before you start working with them. I had it in a frame up at all times so that people know I'm certified to like walk you through this process. I'm not here to you know, be a broker or get you into a certain plan. I'm literally just an educated volunteer who is here to like help you walk through this process. The training is called MLMS, and that stands for Marketplace Learning Management Center. And it's accessed through a website, the CMS Enterprise Portal. Don't worry, I have screenshots of what all that looks like. Like I said before, if you sit down and do it in one, it takes about, I would say, 5 to 10 hours. There are 8 required courses. My advice is only do the required courses. That's my advice. But if you love this stuff, please do the optional courses. The training is self-paced, so you don't have to sit down and spend 10 hours on this. You could take a couple of weeks to do it. But open starts in November, and so you really want to be, you know, finished with the process before November 1st. But the training is self-paced. You know, another quick thing about the training is that it's really, really thorough. And if you don't always pass the tests at the end of the trainings, it's not a reflection of you. It's not a reflection of your intelligence. I getting recertified, have failed trainings, and I do this work all the time for the last like 5 years. So it's just really not a reflection of you. Just be patient. You can take the test multiple times. You can use Google, right? It's open book. So, I really just wanted to say that because I know working with volunteers and being a CAC, you can get really frustrated when you don't get through those required courses as quickly as you thought. They're just really, really thorough. A lot of the information you will use, a lot of the information you won't when you're doing a day-to-day. Self-paced, take your time, not a reflection of you if you don't pass all the tests immediately. The training does go dark from August to October each year to update. So you won't be able to access the training until next month. So just keep that in mind as well, because they have to update it every year for the next plan year. And you do have to recertify every year. So this isn't something you can do once and then, yay, I wish it was like that. You have to recertify every year, just in case it's updated information. All right, so after that, it's ready, set, go. So you're gonna create an account CMS Enterprise Portal. And remember, that's the Center for Medicaid and Medicare Services. You're gonna go to portal.cms.gov. At this point, you're gonna create a username, a password, and you're gonna do security questions. Just like anything else, you want to, write all those things down, make sure you remember all of those things. Even me, I'm like, I don't remember my favorite toy in 3rd grade. Like, make sure you write all your security questions down, all that kind of fun stuff. Once you're in, you are gonna have to do an identity verification via Experian. It's not gonna pull your credit or anything like that. But you will have to verify your identity. And to do that, you'll need to put in your birth date, your social security number, and then there's like a multiple choice background check. I don't know if you all have this experience, but I ask you, what was your previous street address? Make sure you pick the right one, or what was the make of a previous car, or old phone number, things of that nature, to just make sure that it's you. Because remember, this is a federal government process, so we want to make sure that that's done. All right, so once you get past that Experian sort of background checky type of piece, you're in. So the first thing that you want to do is you want to request add apps, right? And like Melissa said, you guys will get copies of this after the training. The second thing you want to do is you want to pick federally facilitated marketplace MLMS training access, and I've screenshotted all of this. So when you do it, you'll have it all here. So that's the thing that you want to do. And then you want to request a new system access, and you want to click assisters, right? So this is going to help get you to the training that you need. So make sure you look at these slides and just walk through these processes, and this will help you get to the training that you need. You want to put in your organization type, which is CDO, your CACID, and then these are the things that are required. Everything else is not required. So we just kind of start here what's required. But you want to make sure that you complete your assister profile and with these things. And again, we'll get you all that information, and you'll have all this after. So the next step is you're going to see your portal dashboard, and then you're going to see your training options. And then it'll say actions, and you want to click on actions. And then you want to click on view detail. And then you're going to click complete enrollment. And this page will have all the trainings that you need to complete here. So as you can see, it's the training overview, the coverage basics, the Affordable Care Act, privacy, security, and fraud prevention, all the different types of things you'll need to help walk people through the marketplace application. Right? So then you're going to see your confirmation page. You're going to go to the current learning. And then once you hit current learning, you're ready to go. You're going to click launch, and boom. Yay! The training's going to pop up, and you're going to begin the course. And the training is like a series of like slides. I think there might even be a couple videos in there. Pretty text heavy though. But yeah, so you click this. And then the training overview is going to pop up in another window. So you're going to make sure that you hit approve, I don't know, on your browser when it says like allow pop-ups, make sure you allow pop-ups, because the training is going to pop up in another window. So it's lots of knowledge checks. They're multiple choice, and you get 2 attempts. Incorrect answers don't count against you. Big tip, you want to screenshot your course completion page just in case anything happens, just in case you lose anything, just in case the website crashes. Screenshot your course completion page so that you can get on the phone with someone and say, I actually completed this. This is the number that said I completed it, just in case. That's a big, big tip from personal experience. Yeah, so this is kind of what course completion looks like. And then you're just kind of going to walk through each training. Like I said before, it is self-paced. So you're just going to keep going through the web-based trainings until you complete them. You have to pass all the exams with at least 80%. But again, it's unlimited amount of attempts. If you don't make 80% every time, no big deal. Just take it again. And then once you've completed your certification training, screenshot that as well, and then provide that screenshot to your CDO organization, so that Health Center or Young Invincibles or whomever it is. And then we or your CDO will provide you with a CAC certificate, and you're on your way. So any questions about the training piece and actually like taking the course online to become a CAC and get your certificate? Right? CAC, easy as 1, 2, 3, not so bad. Okay. All right. So now let's talk about the work of a CAC. So at this point, you have connected with your CDO organization that's going to designate you. You went on CMS website, the portal, you've registered, you've taken all the tests, you've gotten 80% or above. You're actually got 100% because you're so smart and amazing. You've got your certificate and you are ready to be a CAC, right? So let's talk about what the actual work looks like. So the first thing you need to do is you need to meet new consumers. Now, depending on your CDO, it might be, you know, your responsibility to go out in the community and do that outreach. So you might have to find community partners, or you personally using your own personal networks are finding new consumers, or certain schools will have events that they standardly go to, or they have a base of people that they enroll all the time every year. It just kind of depends on the CDO. But the first thing you're going to do is you're going to meet new consumers. You're meeting uninsured people, which in Texas we have plenty of, unfortunately. And so we're going to do that. And then you're going to kind of explain your role as a CAC. You know, this is who I am. This is what I do. Have you heard of Obamacare? Most folks will say yes. Have you ever tried to sign up for a plan? Most folks will say no. And then you kind of have that conversation. You gain consent from them first. You want to say like, you know, do I have your permission to sort of like talk you through some of these things? Most people will say yes, because at this point they're, you know, kind of their interest is piqued. And then you want to do like a general screening for folks. So, you know, do you currently have health coverage? You know, do you have income? How much and from what sources? You kind of want to like learn about people's situation a bit to see if they would be a good fit for enrolling in a health plan. And if it's possible, you want to ask them to create a marketplace account ahead of an enrollment appointment with you. So because once you do screening, say, okay, go on healthcare.gov. When they go on healthcare.gov, they're going to create a marketplace account. And then you want to see if you can kind of schedule that one-on-one appointment with them so you can kind of walk them through the application. So these are some places where the consumers might stumble. Now, most folks, when they create that marketplace account, that's super easy. It's just like an email address, security questions, that kind of stuff. That part is really simple. When it's time to do that appointment with you, here are some places in my personal experience where folks kind of stumble a little bit. So the first question of like, who's in the household? When people hear household, a lot of times they think, who do I live with? And less of like, who's in the household. Think of it kind of like when you file like taxes. I kind of help people explain it that way. Like, not just like who else do you live with, but like who's like depending on you when you file taxes, like who do you list? Those types of questions. I find that kind of framing to be a bit more helpful. And when you're out doing your CAC work, or if you do other eligibility work for other programs, please feel free to put in the chat how you kind of frame that question. But folks kind of stumble there. The income calculation piece is another place where consumers might stumble, because the marketplace actually asks you to project how much money you think you will make the next year. It doesn't ask you how much money you made in your current year. So when you are signing someone up for a plan for 2021, the application is going to ask, how much money do you think you're going to make in 2021? And a lot of people can't really answer that question. So, you know, we live in an economy that people have multiple jobs, people are low income, they're working the gig economy, all different types of things kind of go into. And so that piece can be a place where people kind of stumble a bit. The eligibility determination is another place where folks kind of stumble. So understanding the whole process, and I'm not sure if folks on the call have ever done a healthcare.gov application before, but when you complete the application, it tells you how much of a tax credit you can get based on your income, household size, you know, all the things that you entered in. And then the tax credit goes toward paying off a premium. So a lot of times folks will see the tax credit number and they think that that's how much the premium costs. And I know it's crazy, but people will be like, oh my God, this is $300. I can't afford this. This is unaffordable. And you're like, no. The $300 is how much money you're getting toward paying for your health insurance. So just, you know, having, again, that health insurance literacy is really, really helpful. And then the second piece is you have to decide, you know, how much of the tax credit you want to take, and then how much do you want to get back at the end of the year. So that's like another decision that the consumer has to make, you know, based on their income and where they're at, because they don't have to take all of the tax credit to go toward their premium. And then lastly, there's another piece where someone might not qualify for the tax credit at all, but the eligibility determination might say other people in your household qualify for Medicaid or CHIP. And then there's a process of making sure that those people understand what that means and that they can get their children enrolled in Medicaid or CHIP if they're not already, right? So there's just lots of different, you know, kinks there of understanding the eligibility determination once they get that at the end of the application. And then of course, the biggest thing why CACs, in my opinion, are so needed is how to pick a plan, right? Because let's say you get the tax credit, all right, now you've got all of these plans in front of you. How do I know what to pick? Let's say I'm a diabetic, or I have certain medications, or, you know, just certain healthcare concerns. You know, how do I know what to pick? How affordable and really is best for me and my family? And that, I think, is where the CAC plays a critical role in really helping people understand costs, helping people understand networks, seeing that their doctor is a part of that network, helping them understand the prescriptions and sort of all of that, and really helping them work through their options. Yeah, perfect. So that is where consumers might stumble, and, you know, where I think CACs really play a critical role. Okay, so.
I just want to, I'm so sorry to interrupt you. I actually was trying to copy and paste, and I put some stuff in the chat that is not supposed to be there. I apologize, everyone. You'll see this on Friday.
No worries. So here's some more common challenges. Bumps in the road to getting folks enrolled, because, you know, here's another thing too, right? Once someone gets that eligibility letter, let's say they got a tax credit, that's what you really want. Those are the great appointments. There's still some bumps in the road to actually getting people to like enroll in a plan and really like pay that first premium payment. Cost, you know, I am a huge advocate for the Affordable Care Act. I think it has brought our country and our state a long way, but there are going to be times where even with the tax credits, it is still unaffordable for people. And that's just a reality, especially given everything that's going on right now. So I just want to be, you know, super clear on that. The Affordable Care Act is not perfect. And for a lot of people, it is still not affordable. In addition to that, I'm sure a lot of you on the call know, our state did not fully implement the Affordable Care Act the way it was originally envisioned. So we did not expand Medicaid. And so you are going to run into a lot of people who are not going to qualify for the tax credit because they were supposed to actually get into a Medicaid program had the ACA been fully realized. And so they're going to, and you are going to be walking through the application with them, see that they didn't get a tax credit, and see premiums that completely are unaffordable for this person. That's because they probably should have been enrolled in a Medicaid plan, but because our state chose not to accept those dollars, they also don't have access to Medicaid. So, those folks are really, have a range of emotions, when that happens. And I always like to have, and Melissa will talk about this in another presentation, but always like to have a list of resources where they can, know where a federally qualified health center is, know that they can go to a legacy health clinic, Avenue 3, wherever that place is, that they can receive some type of care, and make sure that you have those resources on hand, because that's going to happen to you a lot, especially here in Houston, and especially given everything that's going on with COVID and job loss right now. For returning customers, so let's say you have someone who they got help last year, now they found you, they want help this year, they probably forgot their username and password. And this happens a lot. They just forgot their healthcare.gov username and password, so you have to help them get into their account. That's something that would happen a lot. Another big challenge is they're not sure if their employer offers coverage, and that's one of the questions that's on the marketplace application, and so they just kind of have to go and figure that piece out. Another thing, something that I mentioned before is inconsistent income. Especially me, I work with a lot of young people that work 2 and 3 jobs, that have work study jobs, gig economy jobs. They're driving for Uber, they're delivering for DoorDash, they're working at restaurants, they're getting tips, and it's really hard to project how much money you're going to make in 2021. And so that's another common challenge. Lack of supporting documentation is also a big one. And then any sort of incorrect eligibility determination that might happen, or incorrect information provided by a marketplace call center, or actually, anyone else that gave them incorrect information. These are some common challenges that you might run into that you kind of need to know about on your journey as a CAC. Oh, I see some Q&A questions. Let me pause right quick. Actually, Melissa, I can't see the questions. Can you tell me what those are?
Sure. Yeah, I'm sorry. I'm not sure why you aren't able to see them. So, yes, great. So question from Esther. The income for the applicant includes the household projection or just for the person applying?
Does the income for the household include the household projection or just for the person applying? Mm-hmm. It's a great question. So, it's a really good question. How do I answer this? It includes, if the person applying, let's say, if they're applying for like just themselves and their children, for example, and they're obviously their children's not bringing them any income, then it would be like just for themselves. If they are applying as like a family or like husband and wife type of situation, I would put both. But Melissa, do you have any?
Sure, yeah, I can. So it's based on how they file their taxes. So as a reminder, the advanced premium tax credit is a tax credit. You're just getting it early. So everything is based on the income that's actually going to turn out on your taxes. So if you file with your husband or partner, then their partner's income is going to be included in that household income. And then just to clarify, Aurora is absolutely right. So you wouldn't typically have children with income. However, the household size does include everybody that's on your your taxes. So if you've got 3 people all together, so maybe a head of household and 2 dependents on your taxes, then you would have a household size of 3. So household size is everybody on your taxes. Income is everybody who has income on your taxes. That's the general rule. Right. There are always exceptions to everything when it comes to eligibility policy, but that's generally how it works.
Yes, thank you.
There's another question.
Oh, great.
If a client's wife or husband has insurance, can the husband or wife not working due to COVID get insurance through the ACA.
Yes.
Yeah.
Yes.
The one caveat I'd have to that is, and this is actually something I'm happy, I'll actually put my blog post in here. It's from several years ago, but the information hasn't changed. So there's something we like to refer to as the family glitch. And so what can happen is that maybe a husband or wife gets insurance through an employer, and they have the ability to enroll their spouse in that employer plan. But often employer plans, especially, often you have to pay sort of full price if you want to enroll, or a very, very high premium to enroll your spouse. So it's unaffordable to enroll your spouse, but just if the plan is affordable for the person who's actually working at that, for the actual employee, then it's considered affordable for the spouse, even if it's free for the employee and $500 a month for the spouse, which obviously is a huge difference. It was a drafting error in the law. This wasn't purposefully done this way, so don't try to understand it. It's not good policy, but there are certain times where you'll run into this, where they could get insurance through their spouse. They don't do it because it's so unaffordable, and technically they're not eligible for the ACA subsidies. They could pay full price for an ACA plan, and some people do that, but they wouldn't be eligible for the subsidies. And as I said, I'm happy to put my blog post on the family glitch in the chat. Just give me a minute to find it.
Awesome. Thank you so much.
I think that answers the Q&A for now.
Thank you so much, Melissa. And yeah, like I mentioned earlier, I definitely encourage clients and consumers to think about household as taxes, and when you file your taxes, who's head of household, who puts their income on there, and really to use that framework when I'm walking them through the application. So let's talk a little bit more about, and thank you all so much for putting those questions in more, but why is this work so important? So there's really, really good data out of KFF or Kaiser, I think, Kaiser Family Foundation, I'm pretty sure, about the importance of CACs and, just why the work that you all are going to be doing is so incredible. So they surveyed consumers, and 62% of them said they sought help because they did not understand their health plan options. And over half sought help because the application enrollment process they felt like it was too complicated. And again, in my experience, that definitely was the case. Also, consumers want help. 82% of consumers surveyed did not get help with their enrollment, but they indicated that they would have sought enrollment help if it were available to them. So a lot of consumers and people who are looking for this type of stuff really want help, especially our population, millennials, Gen Z, definitely want the help. I know so many folks, it's their first time, accessing health insurance on their own, and really need help understanding these concepts. It's kind of like the same with financial literacy. Literacy is just something that a lot of communities just don't have access to. And then, it works. Enrollment helps. So 94% of consumers who received enrollment assistance said that it was helpful for them. And 4 in 10 consumers said that it was unlikely they would have gotten covered without the help, right? So the work that you're going to be doing is really, really critical. But here are some more resources to sort of get you through it. So of course, you got YI, Young Invincibles, you've got every Texan on the call right now, and we'll be following up with this presentation and the recording and how to get involved in our coalitions. We run a statewide coalition, and we run a local coalition called Enroll Gulf Coast that works with community partners who do just this, who enroll people in Affordable Care Act and Medicaid and CHIP plans. So we're dedicated to making sure as many people in Houston get covered. There's lots of trainings and webinars from other great partners, including Out to Enroll, the CBPP's health reform webinars that I think are really helpful. Of course, CMS has some marketplace webinars that I think are helpful. There's also Community Catalyst, Center on Budget and Policy Priorities, and some other national groups that do a lot of great continuing education resources. And once you sort of get with us, you're stuck with us. So we'll be sharing these resources out with you as much as we can. And of course, other CACs and navigators, other folks who've been in the space doing this for many, many years since the very first open enrollment for Affordable Care Act, especially Change Happens here in Houston. They're an incredible resource and have been doing this for years. So those are some really great resources that I think can help get you through it. So key takeaways. The ACA created certified application counselors to help consumers navigate the complexities of this new health insurance system. You, as a CAC, will offer free, expert, impartial assistance to people seeking health coverage. You have to get certified by having successful completion of those webinars from CMS. Both you as a CAC and consumers face challenges during the enrollment process, but when someone qualifies, it is incredibly rewarding and just an incredible experience. Your work is really important, it's invaluable, and it's appreciated by your clients and consumers. And you should take advantage of all the available resources that Melissa and myself will be flooding your inbox with very soon. And this is just a really great quote from a navigator that we like to share. It says, "They think of me as family." And again, like I said before, becoming a CAC was really one of the most rewarding experiences of my life. I mean, I would literally watch people with tears in their eyes after being able to access health insurance for the first time. And I just really hope that you all get to experience that too, if you don't already in some other capacity. So we're gonna spend a couple of minutes now talking about virtual outreach, because obviously we got to social distance, right? We got to stay safe. So I wanted to provide a couple of things that we're doing to help with virtual outreach. A couple of things that I've seen from Houston groups and Austin groups that I think are really cool and fun ways to like get people interested in ACA plans. And then we're going to talk a little bit about the connector tool, and we'll wrap this up. So my first question is, are there any virtual events or outreach tactics that have, you lately, you as a person have seen that were really cool that you want to kind of share? Feel free to use the chat box for this if there are any that you have seen. I'm really interested to know if there's something that I missed. I know one really cool one for me is the versus battles that have been on, I think they're on Instagram, where they have two very similar musicians kind of go against each other. So it'd be like Alicia Keys versus John Legend, and like, they've been really fun and really like engaging people like during this time. But is there anything that has been virtual events or outreach tactics that have excited you lately? I'd love to see them in the chat box. And I'll give folks 1 minute to pop anything in if they've seen anything that's cool. No? Every Zoom webinar y'all have been in has been really boring? All right. Well, feel free to pop some in as I continue the presentation. So one thing that I've seen that I think has been really cool, and something that YI and Every Texan is doing, is we're providing trainings on remote enrollments, which has been really cool. We're putting on a virtual summit for people who do this work for CACs and navigators across the country. At Every Texan, they had a really great group out of Austin do a training on providing enrollment assistance remotely. So that's one thing that we've been doing as your partners in this, and trying to make sure that you have the tools that you need to be able to do this work remotely. We've also been dedicating lots of resources to consumer tested paid digital ads. And these ads will send consumers to either healthcare.gov directly or through to the YI connector. And I'm going to talk to you all about what the connector is in just a bit, but we're really like spending, lots of funding to make sure that folks know about healthcare.gov and the YI connector, so they can get connected to CACs and navigators across our city and across our state, to make sure that they have access to the enrollment assistance that you all provide. And we can talk about how you all can get on the connector tool in just a second. Also, a big digital event that we did was this event called Healthy, which is really exciting. It was a week-long event on healthcare that was put on by young people in my network that we work with. They had a lot of pivotal discussions around healthcare for young people in Texas. And it was this young adult-led, really interactive webinar, healthcare conference. And we directed a lot of folks to the connector tool to make sure that they had the resources that they needed in case they were uninsured and were interested in an ACA plan as well. So we're also putting on digital events to sort of drive young people to you all so that we can make sure that we're connecting them as much as we can. And then we're also doing lots of work on storytelling. As you see in the pictures, when I shared my CAC story, it's really important that we capture the success of the Affordable Care Act. I think the Affordable Care Act right now, it's got a bad reputation sometimes. So I think it's really important to capture the success stories and to make sure that folks know that it is a resource that is available to them. And I think you all as CACs are really critical in doing that. One thing I did was have folks take photos with I Love, ACA, or it could be whatever you want it to be. It could be a video vlog. It could be asking people to write a blog. It could be asking people to share a story. But I think that's one really critical thing that CACs can do to sort of spread the word about the resource. And you can put it on your social media sites. We could put it on our social media sites and drive more folks and clients your way. Oh, cool. Nice. So I see some chats around some emerging virtual practices. So folks are liking Kahoot for quizzing and polls, and then playing Two Truths and a Lie is always a classic. And then having a 30-second dance break. Oh, those are really cool, Crystal. I love those. I should have had everyone here do a 30-second dance break. How cool would that have been? I really love that. So we could talk a little bit more about some other virtual outreach practices that you can do right now as well. So one thing I think I've seen is these mutual aid documents that have been going around since COVID. So lots of people have been sharing resources, right? Like, here's a list of food banks. If you are an undocumented person, here's a list of legal resources. If you get evicted, here's a list of legal resources. All the things that folks are needing in this moment of crisis that our city and our state is in right now. And a lot of those pages have, healthcare resources on them. So I would, if you become a CAC, I would list yourself, as a resource. If you're looking for healthcare, if you lost insurance, you list yourself here, on these sort of digital mutual aid docs that you're seeing going around. Feel free to put yourself on there and say, hey, you can come to me. I can help you sign up for healthcare.gov plan. I can help you connect you to an FQHC, whatever it may be, and put yourself as a resource on there, or your organization. I think that's really critical. And I just saw this glaring, hole in these sheets. Like, where are the healthcare resources on here? So those sheets have been going around a lot. Another cool practice that we do at Young Invincibles that I think other groups can replicate is text banking. So we use a platform called Shadow, and it basically will send out automated texts to your phone list. So if you're a CDO or your organization has a massive, not even maybe massive, but a sizable enough text list where you have phone numbers, I would do text banking. You can get volunteers to come together and send out these texts. It's super easy, and they can literally click what the responses are. But basically, hey, I am Crystal. I'm a volunteer at Young Invincibles, and we're signing up people for health coverage. Are you covered? Right? And you get people to volunteer to do text banking, and then folks might say, no, I'm not covered. I am interested, right? And then you can kind of funnel them into appointments that way. So if your organization or your CDO has a text phone list, I would definitely recommend this. We got a lot of people connected to our connector tool by doing this. Another big one that we did at YI, of course, we work with young people. So we do a lot of social media, and we turned it into a competition with our advocates. So we have them use the hashtag advocates at home or YI Texas. And we made it a big competition, and whoever got like the most engagements from their social media posts, or whoever had the coolest, social media would win things like a t-shirt. We would mail them a t-shirt. We would mail them a coffee mug, like low cost things, but to help keep people engaged. Everyone was on really scared. We're still online and really scared, right? But the social media competition was like a really fun way to call attention to healthcare and really do that. And I think it's something that your groups can also replicate. If you have volunteers or if you have staff, the social media competition is something that you could do. And if you're really interested in this, I would no problem sharing out like our social media competition, the rules and all that. We can definitely kind of share that out, and you guys can easily replicate it. And these are just some more really funny examples and some really cool things that they did. They got really into it. So they made a bingo card, they made Twitter threads, they made TikTok videos, they sang, they did a lot of really cool things that I think you all could replicate, and that your staff or your volunteers could replicate and really have a lot of fun with. I think this is a really cool one. Hopefully y'all can see or hear this, that I could show. My heart went. So this was a fun one, kind of like encouraging young people to stay at home when the coronavirus first hit. We wanted to make sure everyone was staying at home and social distancing. So the theme that week was staying at home, and she created a really cool video about doing her cool makeup challenge and all that fun stuff. So that's just one example of something that our young people did that I think your staff or volunteers can replicate too. And this is a really exciting thing that I saw from Change Happens right here in Houston. So they did a backpack and supply drive and giveaway, but it was like a drive-through. So, of course, normally they would do something like this in person, but they did a drive-through backpack day, and, they gave out backpacks to children who were going back to school. And inside, right, they inserted their flyers about the services that they provide. And of course, the services that they provide are health enrollment. And so I think that was a really cool way to sort of insert their services into these book bags, so that their parents could see, hey, if you're lacking health insurance, if your child needs access to Medicaid, they're a center that can help people navigate that process. So if you see these sort of drive-through giveaways and you want to put your organization, your CDO, or your information there, I think this could be something that's really cool as well. And I thought that Change Happens was a really good example of doing outreach and social distancing pretty well. The next cool thing I wanted to highlight is this idea of virtual resource fairs. So this was put on by a university, and they had pre-recorded videos of the campus, and they had lots of different community partners on like a Zoom call very similar to this, where they talked about all the different resources that they provide, and they provided small gift cards so that people could have ice cream, during this sort of online virtual resource fair, because they couldn't do a normal resource fair where they would have like tables and the partners out there at the university. So they did one virtually. And I think this is a really cool event that you could put on and really showcase your work as a CDO or as a CAC or as a health center, wherever you're from, and really kind of showcase what you do. These virtual resource fairs, if you see an opportunity to put one of these on, I think this is a really cool outreach and social distancing tactic. And last but certainly not least, at Enroll Gulf Coast, we do telethons with Univision, and they're really cool. We've been doing them for a number of years, and we actually have it to where CAC can like be on the phone, calling people, talking to people, helping them online. And then there's a phone number on the screen that folks can call and get connected to you. So if you become a CAC, we often need people to staff these. And would just love to have, as many CACs, especially folks obviously who speak Spanish, to kind of come and help us out with those. And this is a really great tactic for us. And it's one group at a time, socially distanced, all that kind of fun stuff. And it's just a very cool and visual way to show how you're helping people. And people can call right then and there, the number on the screen, and get connected to you. And this has been really, really cool for us. We've been doing it for a couple of years. And so last but certainly not least, as you become CACs and as you get connected to your CDO organizations, there is one big tool that we have at YI called the connector. And basically folks can enter in their zip code and get connected to the closest person to them to help them enroll in an appointment. So I just wanted to let folks know about that tool, that we have access to it. If you're not already on the connector, we would love to have you as a part of it, especially if you're providing any of these types of services or you're interested in becoming a CAC and providing these services. It's a great way for people to enter in their zip code and closest to them and boom, schedule an appointment with you right then and there. So last year, we did a couple of upgrades to the connector, but we figured out how to adapt the connector to our new, COVID-19 reality. And so now when you enter your zip code and search for help, normally it would help you find people that were like 25 miles away or less. Now we're doing it to where if you offer a virtual appointment, your organization that you're connected with will pop up no matter what. So we're not necessarily doing it by zip code, but if you offer online appointments, which as a CAC you can definitely do, we can put you on there and schedule an appointment online and sort of walk through the application with you by phone, or if you're doing it through Zoom or whatever, or what's it called, Skype, whatever, you can do it that way too. And we can definitely put you on the connector tool as well. So that is the end of my presentation. I'm so happy you all stuck with me today. Really, really appreciate it. I wanted to make sure we left space for any more questions. Those are some great questions we got in the Q&A box before, but are there any other questions before we let you spend the rest of your day looking at the cms.gov website? And feel free to put them either in the chat or in the Q&A if there are any other questions.
Got one in our Q&A. Do CACs have access to language interpreters? Great question.
That is a great question. I would say if your CDO does, this is my, so there's two different ways you could probably do this. If your CDO, so that's the organization that designated you, has access to it, absolutely. So if your CDO is a health center, for example, and they have staff that can help you do that, that's one thing. Or if they have language interpretation there, that's one way. They could also call the marketplace center, and then they have access to language interpretation for the client as well. Melissa, are there any other resources on language interpretation beside those two?
Those are the two I would have highlighted. Yeah. So you can always do, as a CAC, you can help a person through the application over the phone. It can be a tedious process, but that is definitely a solution if you don't have within your own organization either access to a language line or someone who speaks the language of the client you're trying to serve. So you could do it through the marketplace. Yep.
Yep. Great question.
Yeah, good question. Any others? All right. I have a couple of things that I just want to highlight before we go, and that some of them Aurora's already mentioned, but just as a reminder, this is part 1 of 4. So I'm going to be putting these things into chat so that you know that they're there. So don't forget that we have more stuff coming up. There's the website for this particular series. Again, as you saw, this is a small group and it was designed to be that way. This is, we're doing this training specifically for grantees of the Greater Houston COVID-19 Recovery Fund. So this is an opportunity to get some much more hands-on interaction with Aurora and myself. So take a look at that. If you haven't already, for example, this Friday, I will be going over the Medicaid and CHIP enrollment piece. It's going to be a little different than Aurora's just because Medicaid and CHIP has significantly less sort of structure around it for enrollment assisters. There is some, but it's just less than what was created by the federally facilitated marketplace. So some of it is going to focus more on the programs themselves. So please, take a look, and we'll be doing the 2 next week are focused in on remote enrollment assistance. And what does that look like? If you're doing virtual assistance appointments, what are some of the best practices regarding that? As Aurora's already said, YI is also having a planning summit for folks. So I just put that link into the website as well. So that is on the 17th. Am I right about that? Yep. So later this month. So if you're interested in participating in that, make sure to register. And then finally, together, the Texas Association of Community Health Centers, Every Texan, and YI have all teamed up, as we've done for the last several years, to host the Texas State of Enrollment 2020 conference this year. Usually it's in San Antonio. This year, of course, it's going to be virtual. So take a look at that website. There's actually going to be 6 webinars. They're closer together. They're over a series of 3 days. And we're not just going to focus on Medicaid, CHIP, and the marketplace. We always put in a little, so there's some that's on the SNAP program and Healthy Texas Women. So some of those additional programs that serve low-income Texans. So take a look at the lineup for that. Those are individual registrations, so you don't need to register for all of them. You can pick and choose which ones you'd like to attend, and everything that I just listed out loud is free. There are no registration fees, so don't feel concerned about that. It's just time. I would also final thing I'll say is, even if you don't think you can make it at the actual live event, go ahead and register for the ones you're interested in, because I know that we will be sending out the recordings to everyone who registered, even if they don't attend. So that's the best way to sort of make sure you get that recording in your inbox in case you want to watch it on demand later. Any questions about upcoming events? It's a busy month. September is always busy as we're trying to provide information for folks going into the open enrollment starting November 1st. You are welcome to email us directly if you have any questions about anything. We're happy to answer those.
Yeah, thank you all so much. And we look forward to seeing you all Friday next week and at all these other incredible events we're putting on. Thank y'all so much.
Yeah, thank y'all. And I am going to end. We got one Q&A.
Oh, yay.
Can we get an email with the upcoming events? Absolutely. I will make sure that they are in the follow-up email from this webinar, but I will probably also just construct an email that has all of the follow-up emails are very basic. I can't do anything pretty in them. So I will also make an email and send it to the registrants for this webinar to make sure that y'all have all of this in one place. Great idea. I'm going to write that down right now. And we'll make sure to get that to you. So thank you for that idea. All right. I think that takes care of it, and I will stop recording.